Welcome to SAT TV News. I am Alicia George. In our top stories, discussions continue on the chikungunya epidemic. Haiti police break up violent anti-government protest. India hangings, fourth woman dies in Uttar Pradesh. And in sports division 2014 primary schools championship commences. Details of these will follow. Welcome back. As part of Cottage's Village Feast, panelists from the Ministry of Health in the Portsmouth Health District gathered to discuss what is now described as an epidemic in several parts of the Caribbean, the chikungunya virus. The chikungunya virus carried by the Aedes aegypti mosquito has so far been detected in neighboring Caribbean islands, causing common symptoms such as fever and joint pain. Speaking at the panel discussion, District Medical Officer Dr. Candid Jacob said Dominicans must come to the realization that the virus is in fact caused by the Aedes aegypti mosquito.
If you can believe HIV is as deadly as it is, why is it so hard to believe that a virus carried by a mosquito can make you that sick and make so many people sick?
According to Jacob, the virus has been in existence since the 1700s, when reports of outbreaks of these same symptoms grew widespread. Meanwhile, Senior Environmental Health Officer Clement Maslin says herd immunity and climate change may be mitigating factors to reduce the spread of the vector-borne virus.
Once you develop this form of immunity, then you will find the numbers gradually decreasing, the number of cases that you see on every day. For example, case in point, in the community of Bafeste, we were able to see a rapid decrease in the number of cases that were being reported, as we would find most people have already gone through the disease and it will not be recorded as a new transmission. Climate change may work towards our advantage or disadvantage. For example, climate change may propose harsher, arid conditions which would be able to lead to the killing of the vector, or it may also allow for more torrential rain and more breeding spots for the vector. So climate change on a balance would be able to either give us that force to control, or it may act on it negatively.
The Senior Environmental Health Officer added that source reduction remains as a prevention and key to eliminating the virus. To date, Dominica has over 2,000 reported cases of chikungunya. Despite economic challenges, the Central Cooperative Credit Union, CCCU, an amalgamation of the St. Alphonsus and Portsmouth Credit Unions, has recorded significant growth for the year 2013. According to the board report read by Murphy Wallace, president of CCCU Board of Directors, during the 7th Annual General Meeting on June 11th, the credit union experienced a year-end surplus of over 5 million growth in total assets and 3.7 million growth in total savings and fixed deposits.
But in spite of the various challenges that we saw during the 7 years, yet still we can boast of growth in our membership and in our assets over those 7 years.
In 2013, membership grew by 433, bringing the total membership to 10,964, while central assets grew by 6.6%. The CCCU, formed on July 2, 2007, also plays a major role in promotion, enhancement, and the social development of Dominica.
During the year 2013, Central contributed $17,855 to the development of its members and, by extension, our community. And also at our last annual general meeting, Central presented donations to schools and other organizations totaling $10,500.
Additionally, Wallace reported that CCCU continues to support education through scholarships, noting that the credit union has spent in excess of $18,000 on scholars and to secondary schools on the island. Although the institution has had to re-examine operational policies, they will continue to focus primarily on rebuilding equity and profitability. On June 12, the Ministry of Health launched the revised Maternal and Child Health (MCH) manual, focused on improving the quality of care given to mothers and their children in a bid to reduce infant mortality rate. It is expected that the launch of this manual would sensitize healthcare providers on the availability of the manual and its use in order to provide optimal care to the public. Cyril Yaravalle, MCH coordinator, says the manual is an authoritative step-by-step guidebook and a formal working document made accessible to healthcare providers.
It gives standardized ways to perform maternal and child health activities. It communicates the important, detailed information as it relates to maternal and child health. It reduces potential errors when delivering maternal and child health care. It creates consistency in providing the highest quality maternal and child health care.
It also serves as a point of reference for the majority of maternal and child health information and provides assistance to its users. Ravalier says it is one of the first books that healthcare providers need to guide and develop their maternal and child health skills. Additionally, European Union Representative Lisa Valmont says the Dominica 2010 to 2019 Strategic Health Plan lists high perinatal mortality rates as one of the major challenges in Dominica. This, she indicated, has contributed to the introduction of the EU-funded program Dominica Reduction in Infant Mortality Rate, DRIM.
The overall goal of DRIM is to reduce infant mortality through the implementation of sound activities geared at reducing neonatal mortality, as this latter represents a large proportion of infant mortality. To reach this goal, the intervention sets 3 sound and realistic objectives to bring tangible changes in neonatal mortality.
For the 10th EDF, the EU has contributed $4 million towards the DRIM project. The MCH manual was introduced in 1992 and has been revised to align with international standards. Dominica may be considered as a possible host for the 2015 Caribbean Premier League, CPL, according to Chief Executive Officer of the Caribbean Premier League, Damian O'Donoghue. He noted Prime Minister Honorable Roosevelt Skerrit had made contact with him to discuss the possibility.
We see the appetite in Dominica. So what I discussed with them was coming to see a couple of the games this year and maybe opening up discussions from September, you know, because we have neutral venues this year in St. Kitts and Grenada. And you can see already, you know, the excitement in those regions, even though they don't have a franchise. Just being able to host games has had a big impact, both on their economy, but also more importantly, you know, for the for the people in those countries to experience the special event that is the CPL.
The CEO said any host country must have thousands of hotel rooms available, as accommodation will be a critical part of hosting the event, in addition to an investment by the Dominica Tourist Board and the fee required to host the games. O'Donoghue pointed out the CPL is a great marketing tool for any host country.
The quality of lights and the state and repair of the pitch. We have a local groundsman who works for us called Ken Crafton, so he examines the grounds. We have our operations team who go in and make sure from a health and safety and from an operations point of view that the stadium is up to international standards. And then obviously accommodation is another big one. But you know, the great thing about accommodation is there's ways around it, and that's why even already the demand for St. Kitts is so huge that we're looking at possibly even bringing in a cruise ship in which to house people who are coming in for the games.
The CEO added hosting the CPL costs in the region of US $25 to $30 million. When we return, more stories. Welcome back. 4-H has a bright future in Dominica. However, the organization needs the support of the corporate community for its development and carrying out much needed projects. This is according to National 4-H Coordinator Shirley Alexander, who noted due to the lack of adequate funding, pursuance of many projects are impossible.
One of the problems is the fencing of the gardens. You know, fencing, it's expensive to do it well. But we are really trying to see whether we can help some of the schools to get their fence around the entire school, or maybe just a little plot to fence just the little plot for the garden. those things. Some of them need shade netting, or, well, they ask too for like greenhouses or shade houses. It may be too much for us. For the most part, it's an expensive venture, but we are in our own way trying to help them with fencing wire and shade netting and composting. That too, they are usually asking some for soil or for compost, because some of them have really rocky or unfertile kind of soil, so it needs a lot of help. So we are working with them in those areas.
She noted there are 53 junior 4-H clubs on island, in addition to 9 senior 4-H clubs, which all require resources for their projects, but with limited funding, they can only embark on those of priority. Alexander stated the organization regularly seeks sponsorship from the corporate community. However, some are not always forthcoming.
A lot of times you go to business houses and they say, oh, so many letters, so many people asking for. What can we say? I think it's good to give to programs like 4-H, where it's not like they are just asking for things so they can have fun. We are asking for it because we want to use it for us to do more. We are asking because we want tools, garden tools, we want fencing wire, we want gifts, whatever it is, to encourage them in their agricultural pursuits. So it's a wise thing to do, to give to 4-H.
According to Alexander, 4-H, which focuses mainly on agriculture and the environment, has been credited with molding a number of farmers on the island and continues to do so. She noted the young people are very enthusiastic about farming.
And what we notice is the younger you get them involved in those kind of activities, the more excitement there is. I mean, you show them how a seed germinates, and wow, they're thrilled. What we just hope is that we would get more resources for carrying out projects with those little ones. Because if it's done in a very exciting way, and they learn and they see the benefits of it, then as they go through life, they will feel the urge to stick to agriculture as a career, because we do need agriculture to survive. Everything we have, almost everything, comes from the environment, comes from the land, from the sea, and that has to do with agriculture.
The 4-H coordinator went on to say that the organization continues to make positive contribution to Dominica's agricultural sector. Dominica will join the rest of the world in observance of World Blood Donor Day on Saturday, June 14, 2014. This year's theme is Safe Blood for Saving Mothers, focusing on expecting mothers. The event will raise awareness of why timely access to safe blood and blood products is essential for Dominica, as part of a comprehensive approach to prevent maternal deaths. It also provides an opportunity to thank voluntary unpaid blood donors for their life-saving gift of blood. James Fitzgerald, director of the Pan American Health Organization, says safe blood must be waiting for the patient who needs it. The Princess Margaret Hospital Laboratory will celebrate the event on Friday, June 13, 2014, with a tribute to blood donors at a short ceremony at the blood bank from 9:30 a.m. There will be testimonials from mothers who have received the life-saving gift of blood in very trying circumstances. The highlight of the event will be a tribute to those blood donors who consistently and voluntarily give blood. Members of the public are invited to support voluntary blood donation and participate in an open house on Friday, June 13, 2014 at the Blood Donor Center from 11 a.m. to 2 p.m. to learn about the benefits and gratification of being a blood donor. This has been the local segment of the news.